The inherited metabolic disorders are broadly categorized into three major categories. The first category is small molecule disorders, second category is complex molecule disorders, and the third category is energy deficient. So the small molecule disorders, majority of this disorder, they present at birth or soon after birth in neonatal or infant life. The second category is complex molecule disorders. So complex molecule disorders present later in the life because most of these disorders occurs due to accumulation of end products, accumulation of some products in our body, such as lysosomal storage disorder. Because the degradation pathway lysosome is affected, so lysosome is not able to degrade the compounds in our body, and they get accumulated in our body, and the symptom present later in the life. Similarly, with energy metabolic disorders, the age of presentation can vary from the early life to late life. The presentation of inherited metabolic disorders can be of two types. First is acute presentation and second is chronic presentation. If we talk about acute presentation, so they can present in acute emergency. And whenever a doctor is evaluating these patients for acute emergency, cause of acute emergency, they were not able to figure out the exact cause, such as sepsis, trauma, cardiac events, and they are not able to identify the cause, etiology of that symptoms. So I will give an example. Such as few patients present to us with present to us with encephalopathy. So in encephalopathy, they present with altered level of consciousness. Whenever we evaluate these patients with routine investigations, usually we don't find any defect in normal tests, the routine test. And if you do MRI, sometimes we change non-specific, sometimes we find non-specific changes, or sometimes it can be normal. So in these category, parents and doctors should have a suspicion of inherited metabolic disorder. And the second category is chronic category. So this is the largest category. The chronic presentations can be such as developmental delay, intellectual disabilities, movement disorders, or they can have organomegalies, they can have cholestasis, jaundice, they can have cataract, they can have hearing deficit, so they can have epilepsy, which responds poorly to the medical treatment. So these disorders can present in a chronic manner. So parents should, whenever parents are finding that their baby is not doing well and not growing as expected, then they should consult the doctor with the underlying possible inherited metabolic disorders. So second important is autistic-like presentation. So these days we are seeing this surge of autism, and almost recent data suggests that around 2.8% is the prevalence. Out of 100, we are getting 2.8% with the autistic symptoms. And there are 200 different metabolic pathways that can get involved in the autism, which are described till today. So they should also get evaluated for possibility of underlying neurometabolic disorders.